So the treatment for tremor is really quite multimodal. So it involves medications. Those medications are sometimes helpful for patients, and there are 2 or 3 main medications we use, including beta blockers, but there are others. Medications can sometimes suppress the tremor, but don't often completely get rid of it. In fact, that would be rather unusual. There are injections that we are increasingly using, for example, botulinum toxin, but that has limitations, including the possibility of weakness. We do engage other therapists, for example, occupational therapists, for some patients with tremor who can help adapt one's environment to accommodate for tremor. There are also devices and wearables, for example, weighting of the or making the limb heavier to dampen the tremor, which can work in some situations. We have known for a long time that surgical approaches are very effective for tremor, and this is essentially making a tiny little burn hole deep in the brain, or stimulating with electricity that same area in the brain. Very excitingly, over the last 10 years or so, we found that something called focused ultrasound, so shining many ultrasound beams on that same area in that brain, creating a tiny little lesion, is very effective at abating the tremor. So it's very exciting to see this sort of treatment now available for our patients.